Hey guys, Dr. Jeff Feenstra here with Pro Chiropractic, and just wanted to take a quick minute here on Monday morning to shoot a video on a couple different things. One of the treatment modalities that we use that's really effective with different rotator cuff tendinopathies. There's lots of different things that can go on with the rotator cuff, and so a lot of times it's a multimodal treatment approach. You know, we do some chiropractic treatment with adjusting of the neck, thoracic spine, a lot of times some upper extremity adjustment through the shoulder. And then one of the soft tissue approaches that we use that's really effective is pulse wave therapy or shockwave therapy. And so this is what this looks like. Shockwave therapy or pulse wave therapy, the way that it works is that there's essentially a little object in here that goes back and forth. It's compressed air. It hits the end of this transducer tip. And there's lots of different transducer tips that, depending upon the area I'm trying to treat, if I'm trying to treat like an IT band or a big thick hip or something like that, I can use that. Or different, different sizes depending upon the body area we're trying to treat. And so the way that it works is that it works in a number of different ways. Physically, it actually produces some energy transmission into the tissues that breaks up adhesions, stimulates a lot of microcirculation within the tissue, and it also biologically and biochemically, what it does is it actually improves some calcium permeability into the membranes. It also improves the overall energy transport through some of the cells and things like that. So it's a really effective treatment. It's a pretty deep treatment. So I'm going to demonstrate one of the ways that we use that through Natasha's rotator cuff here. And so the rotator cuff's made up of four muscles. You have your supraspinatus, your infraspinatus, teres minor, and then your subscapularis is kind of up underneath your shoulder blade there. So I'm going to treat mostly kind of through the supraspinatus and kind of back through here, some of those attachment points. A lot of times those little myotendinous junctions are the areas where there's not good vascularity there, and so we want to treat that area to try to bring some energy and some growth and some healing into that area. So the way that this works is I'm going to apply a little bit of ultrasound jelly. And then you'll kind of hear as it turns on, it's a little bit noisy, but what it does, is that feeling okay, Natasha? Okay. So what I'm going to do is I'm basically going to go over that. You can kind of hear how every time that bullet hits that end of that transducer tip, it produces a click. And there's actually a click counter on here that shows me how many pulses I've actually administered. And then I can also increase the overall intensity. I can increase the frequency depending upon the treatment protocol that I'm trying to do. And so usually what I do is we go over top of this area and I try to find areas that essentially stimulate a reaction. If I hit a trigger point, sometimes that trigger point will kind of light up. So right about there, that kind of is a pretty good spot, isn't it? And so a lot of times I'll stay there for 200-300 pulses and then move on. We're just going to basically paint this area. And typically a treatment area is about the size of a baseball, and I'll do that for about 2,000 pulses, and then reassess, potentially move to a different area. And so like I said, typically the treatment area is about the size of a baseball, 2,000 pulses, we move on to a different area. Pretty quick treatment overall, usually 2,000 to 6,000 pulses, somewhere in there, and then we'll do some rechecks and go from there. A lot of times I usually tell patients to expect anywhere between 6 to 8 treatments with this, but like I said, get really good results. It's an excellent adjunct to some of the good stuff we're already doing. Lots of other videos on our YouTube channel here, Facebook website, check us out there. Again, Dr. Jeff Feenstra with Pro Chiropractic.